Great to
Sorry to
see you
hear.
today.
It's
I'm
good to see you.
Lawana. I'm one of the nursing faculty at Regis. I work in the Women's Health Nurse Practitioner program. So really
Awesome.
excited to get to meet you today. Andy Levinsky has been lining up different conversations for us to have with nurse leaders and nurse innovators, and definitely you're at the top of our list for that
Well, thank
group.
you.
I
Thank
will
you.
tell you also that you're special because you're only the third male nurse that I've had the opportunity to talk
Really?
to. Yes.
Oh, well,
So that's
we have to
exciting.
increase that. Tell Andrew
Exactly.
he's got to work a little harder.
Yeah, we got to get some more because it's very good perspective to have.
Yes.
So I'm going to begin by just asking you to introduce yourself to the students and public who will be watching, and
Mhm.
then to just tell us a little bit about the work you're doing currently.
Okay. Um, I'm Dr. Ernest Grant, president of the American Nurses Association, the 36th president, first male president, and the third African American to hold this position. ANA is currently celebrating its 125th anniversary. So I'm hoping that I'm
Wow.
not the last male or the last African or the last person of color
I
to
hope
serve
not.
in this position. So we've got some more trails to blaze.
Mhm.
What ANA is working on right now, it depends on what hour of the day. It's almost sometimes like playing whack-a-mole, but
Mhm.
obviously still doing work in the COVID area, still trying to convince the American public as well as a few nurses and other members of the healthcare team to consider taking the vaccines.
Mhm.
We also last Friday partnered with Santa Fe Pasteur to kick off the flu vaccinations as well.
Right.
And because we're anticipating that, unlike last year, when everybody was home, everybody, was sanitizing their hands and, waiting 6 feet apart and everything else.
Mhm.
Obviously, that's changed. And most people are, they're not sanitizing their hands anymore. They're not waiting the 6 feet apart. And even though,
Mhm.
yes, we're wearing the mask, some people are not. So we can anticipate that probably we're going to have a busy flu season on top of, even though just reports in the last couple of days have said that perhaps the Delta variant has reached its peak.
Mhm.
We still need to prepare for the potential of both illnesses still dominating over the winter months. Um, and then one last thing is
Mhm.
on September 1st, I sent a letter to the Department of Health and Human Services to the secretary there, Secretary Becerra, asking him to declare the nursing shortage a national crisis
Mhm.
and to let's convene a meeting of all government and public and private partners to develop short-term and long-term goals to address this particular issue, because the nursing shortage, I mean, I've been a nurse for 43 years and
I mean, I have
trying to
heard
turn
about
around.
it my entire, I mean, I've been a nurse for 15 years and they
Yeah.
said we're not going to have enough nurses. And we have
Mhm.
continued to hear that
Mhm.
repeated. And I
Yes.
keep thinking we have all these nurses graduating,
Mhm.
what's happening, but
Yes.
we also have people that are retiring.
Yes.
And, and I think now we can see that even though we have a great deal of nurses, the
Mhm.
bedside nurses, are taking a
Mhm.
serious hit with
Yes.
COVID,
Yes.
So,
Absolutely. And
yeah.
that's, well, two other things, and then I'll turn it over to you. So
No,
that was the next thing was the psychiatric and mental health, as well as the physical health of the nurses, particularly those who are at the bedside. They've been
right.
going at it very strong for the last 18 months. And, a lot of them are choosing to leave the bedside or to become travel nurses, thus
Mhm.
contributing to the shortage that we're seeing as well. I'd be
Mhm.
happy to talk about that. And then the last thing, I mean, there's plenty more, but the last thing I'll talk about is the National Commission to Address Racism in Nursing.
Right.
That is something that I have been steadily working on and hope will be my legacy when I leave my term of office in about 14, 15 months from now, that we would have got laid the groundwork for that groundbreaking work to continue and begin to address the issues that we're seeing. So.
Those are, like really keystone type of things that we're having to deal with nursing. And it's funny because every nurse I've talked to, and I think this may be our 10th or 11th conversation we've had, has
Mhm.
touched on different areas that are similar to what you're talking about,
Yes.
with the practices that are going on as far as the disparities, racially,
Mhm.
and everything that's going on with nursing. We see that personally. I'm from South Carolina, so I'm not that
Mhm.
far from you.
Yeah.
Down here in a little tiny, I'm in Columbia now, but I grew
Uh-huh.
up in a small town. And
Oh,
the first hospital I was in was just 116 bed, small hospital. And I recall someone not wanting me to take care of them because I was Black.
right. Hmm.
And what I thought was even, it wasn't surprising to me, but what I thought was more surprising was that when I mentioned to colleagues as I came to a city that was more, racially diverse here in the capital city, they found it unbelievable that
Hmm.
was happening. So
Yes.
shining the light on those type of subjects is
Mhm.
really, really something that's important.
Absolutely.
It
Absolutely.
definitely is. Well, let's take a slight aside and tell
Okay.
me, how did you get from just Ernest Grant to Ernest Grant with all the initials behind your name with the nurses? Was that the plan from a little child, or did something happen? Tell me what happened to get you into this spot.
Oh, that's a great question. Anyone who knows my story knows that I originally wanted to be an anesthesiologist,
Oh, wow.
and I am the youngest of 7 children, single parent. My father died when I was 5, and
Okay.
I grew up in a very small rural community, very poor. And even though I had the grades and could get probably scholarships for part of my undergraduate studies, uh, and speaking with my guidance counselor, he said, well, there's probably not no real guarantee that you'd be able to get a full ride scholarship on through medical school and then on to
Mhm.
anesthesia as well. And he said, probably what you may want to do is consider nursing, because we do have nurse anesthetists. So why don't you think about possibly going to nursing school? And as a result of that, then you can go and become a nurse anesthetist. And if you still wanted to go to med school, you could work your way through that way as a nurse
Mhm.
anesthetist. And that sounded pretty good to me. So,
Mhm.
and then he said, well, you may not like nursing. So, go to the local community college. They have a, 1-year program. And if you like that, you can easily transition into the 2-year, which is what I did. I took the 1 year, about 3 months into the LPN program, totally forgot all about medicine, realized that nursing was my love. And
Wow.
as soon as I graduated from that program, I knew that I wanted to be able to do more. So I did not want to go back and just get an associate. I wanted to get a baccalaureate degree,
Mhm.
and then subsequently a master's, and then the doctorate each time, with the emphasis of wanting to be able to contribute more to the patients that I was caring for, or to healthcare in general. So that's how I wound up in, Ernest Grant, RN, PhD, and all the other letters after my
Oh,
name is from that. So.
that is a great story. So as you were coming through and taking your educational path,
Mhm.
how was that, being that you were male and African American, and nursing is still predominantly a female, dominated field,
Yes.
how did your family, friends, associates, did you find that there was a lot of support? Did you have mentors along the way, since you were, the minority in that sense?
Yes, and you are right in that I was the minority in a number of settings. A
Hmm.
lot of times the only male, or definitely the only African American male. And you could definitely say that I stood out more than usual,
Hmm.
even though I stand out now. I'm 6'6", so
Oh,
I
yeah.
stand out just in general. But no, I did have a tremendous amount of support, from the very first endeavor all the way through to getting my doctorate. Have a number of mentors. I could start mentioning their names, but then I'm sure I'll leave somebody out, and they're going to be listening to this and get mad. But quite a lot, in so many different ways, not just in nursing. And I would encourage the students that may be listening to this, that you need at least 3 mentors, but one maybe from nursing,
Mhm.
one from who could be that friend that could tell you the frank and earnest things that you really need to
Mhm.
hear, and not be afraid and not have it destroy your friendship. And then, somebody, perhaps out in the community that you respect, either, like a pastor or a community leader, or, just someone that you admire. I would strongly encourage that you have at least 3 of those, and bounce things off those individuals, and just see what they say. But the one who is not going to be afraid to tell you what they think, and that's usually going to be the person who pretty much is, they know you very well, they know your mind, and they're just rubber stamping what you already are going to do. So, or at least that's the way that I found it to be. And so it's just good to have that that person confirming everything that you already know that you need to do.
Yes, I love that. I call it the keep it real person. You
Yes,
need that
absolutely.
person that's known you, and they're like, listen, I know you're a nurse now, but I remember when you weren't nobody. And let me just say, this is not acceptable. So you do need that. And it's good. And you find those people, I think, along the way in your professional life, where you are. I have even coworkers that I work with. Something happened at the office yesterday, and I texted them. I was like, now, you all would have told me if this was out of line. And they were like, yes, we would have told you. Because sometimes you need someone to just check you. So it's good for students to keep that in mind. And in looking at nurses, and I can't help but think that all of us who are nurses, when COVID came, we weren't aware of the monster it was going to become. We learned that along the way. But immediately what I thought about was, what can I do? I'm not at the bedside anymore. But what can I do to help? And I think a lot of nurses felt that way. For me, I had worked with the health department here before. So I got in touch with them, and I did some epidemiology case investigation for them from home, doing that. So as COVID came through and hit, and I know this because you've also been of great service to your country, even back with 9/11 and the work you did with burn victims there. So can you just speak to what that call to action kind of felt like for you from where you are as you were seeing things evolve and thinking about, what can I do?
Yeah, there was about 3 things that I did. One, we began to, when we realized that obviously it's going to hit our shores, we began to strategize at that particular point and say what it is that nurses are going to need. We realized, first of all, they're going to need education about not only this virus, but also about donning and doffing PPEs and things of that sort. So we quickly literally turned on a dime, because I remember we closed the office on Friday. That Monday, everybody was working from home, but we began to turn on a dime and get those resources that we knew that nurses needed. Those educational courses and things that and put out there for nurses to go to our website and have some some of those educational webinars that we had put out. Even some, just a refresher, like how to care for a patient on a ventilator, because we knew that people were going to be drafted from non-ICU personnel, maybe drafted into the ICU setting, and they would need some little basic things like that.
Yeah, the ventilator is scary to nurses too.
Yes, absolutely. And then the second thing we did was to started looking at the supply chain and working with members of Congress and trying to get them to free up the supply chain. And of course, you probably recall that the national stockpile, when they went to access those things had dried out. They were useless and et cetera. And so ensuring that what was being put out there met the OSHA standards. We found out that I think probably close to about 100 million masks that had been purchased did not fit the OSHA criteria. And these are masks that were going to be going to healthcare workers, thus exposing them even more, to that. So we had to notify the federal government, you can't put these out there because of the the risk that they would pose. So along those lines, just addressing the needs for the that nurses may have. The second thing I did, obviously, when we started hearing that vaccine development had gone into place, I was had made an inquiry to one of my docs and suddenly found out that I'm here in North Carolina, Chapel Hill, North Carolina, and I found out that UNC Healthcare was participating in the Moderna clinical trials.
Mhm.
And so I had asked my doc, are they still open? And he said, yes. And he said, you'd be perfect, because they were looking for people of color. They were
Right.
looking for older adults, which I fit that criteria. And then I wanted to do it as well as president of ANA, because what I wanted to do is to do something that would put me in solidarity with those nurses who were at the bedside, so that if they saw that their national leader was, essentially sort of putting his life on the line, if you will, to take a vaccine that we didn't know, how it was, would be acting or whatever. But my idea behind that was to prove to them that if it was proved to be successful, there would not be any hesitancy on the part of healthcare workers to take the vaccine. So I did participated in the Moderna trial. I did get the true vaccine, because I knew that after the second dose with the the fever and the chills and everything else.
Oh,
So
yeah.
which was great. And I have continued in that clinical trial. Mainly, we were given the option. It was a double-blind study, and once it was unblinded, and confirmed that yes, you did get the vaccine, we were given the option to either drop out or continue in the study for 2 years, and I chose to stay in the study for 2 years, again, just to to help contribute to that body of science, along the way there. And then other things I've done too is, like, as the vaccines have rolled out, participated in vaccination clinics, a number of those here in the Chapel Hill, Raleigh-Durham area, and also just been quite the advocate to, every opportunity I get, and talking with the news media, encouraging individuals to, to take the vaccines as well.
Well, that is amazing. That's a great mark of leadership, in knowing the way and showing the way and going the way
Yeah.
to actually put that out there. And, with the vaccines, there's here in South Carolina, we finally got to like 52%, like this week. It took us a long time. A lot of the communities, you and I both know that there's some, stigma attached to medicine in general from the African-American community. We have a lot of rural areas in both North and South Carolina where you have to take a different approach. It took me until 2 weeks ago to get my parents to finally get both doses, because I had to do a lot of finagling and talking and you preaching and all of those.
I hear you.
Yeah, you did. So how do we as nurses even encourage those, because we do have a few holdouts, and I know a few even of our profession that are working in units but just have that hesitancy towards getting the vaccine. What do you think is the key kind of for even those that may be in healthcare?
There are so many ways to approach that. The first thing, and it's not, and it's not that I'm saying we should shame them, because we shouldn't.
No.
What we need to do, and what I have found that works best, is to listen to their concerns intently, one-on-one. Just like you and I are having this conversation. And what I find overwhelmingly, it is younger nurses who are saying, well, I've heard that it interferes with fertility. That's the number one thing. And when you say, well, up until this very moment that you and I are talking, this is my response to them, it's this very moment that you and I are talking, there are absolutely no studies out there that have shown that these vaccines interfere with your fertility. And I said, show me. And of course, as always, they get their information on social media.
Yes.
And and so this is when I say, as a professional, that we deal in evidence-based, information. The information that you're getting on social media is because someone said that this happened, or their cousin did this, or whatever. Or if it is supposedly a health report, look at how it is done. Is it published in a peer-reviewed journal? Does the person who's published it, what is their field? Are they an epidemiologist or a virologist, or a doctor who would know what they're doing? Or is it someone who hasn't published a paper in over 20 years?
There you go.
And now they've got this. And the mere fact that in a non-peer reviewed journal should be a red flag for you, because we're taught when we are contributing or looking at evidence-based practice and et cetera, that it has to be, peer reviewed. You have to see these things over and over again. And so usually that's enough to get them to seek and get more information on their own. And I encourage them to have those conversations with their providers as well. Don't just listen to me. Listen to your provider. Go to the CDC website, go to the ANA's website, or any other trusted website that you can to get the information that you need to, to make that decision. And about 95% of the time, they do make the decision to go ahead and get the vaccine.
Right.
But these other little rumors, like, there's a chip in the, it's like,
well, the chip is already out. It's in the cell phones, people.
Yeah, that's what I tell them too.
They don't need it. Yes. They want to find
know where you are. Just keep your cell phone turned on. And plus, I'm going, well, the vials are multi-dose vials. So let's see, if you get 5 dosages out of each vial, that means there's 5 chips. So you got to be really careful. To make sure you get
how would you do that? Yeah.
But, it's just getting people to really think rationally and to, say, and to question. It's just like there's a lot of questions that are put to me. Well, I don't know what's in it. Well, my response is, do you know what's in Tylenol? Do you know what's in, Benadryl? Do you know what's in that antihypertensive you may take? And of course, there's side effects to every medication, but there has never been anything more. This is the largest clinical trial ever in the history of man, when we have given over, I believe, at last count, it was close to 3 billion injections around the globe of these vaccines. Yes, you're going to have side effects, but they're nowhere, outrageous of the numbers that you expect to get from side effects from any other medication. And it's the same thing with the flu shot. You don't know what's in the flu shot every year, but yet you take it. So it's, it's a matter of just getting people to really think rationally and to, see what is, what is what. But that's usually the approach that I try to get, is just reason with them one-on-one.
Yeah, that conversation makes a difference, to just hear. I think what people sometimes want is to be able to be heard and have those things addressed, and then they feel better about it. But yeah, with social media, I'll say to my students, I want to get information from someone that knew the word coronavirus before 2020. If they just heard it last year, I don't want to talk to you. I want somebody who could have told me in 2015, 2000 what coronavirus was. Those are the people that we want. So we have to fight that disinformation. One other thing I want to touch on, and I will say that this was a point of brutal honesty for me when I was looking at your information, and I was thinking to myself, when it comes to membership in professional organizations for nurses, this is not something we hear a lot about, and I want you to speak about the benefits of it, simply because from my standpoint, when I was in nursing school, I was a non-traditional student, didn't get my first degree till I was 36. I was broke. I had 4 kids. I was trying to make it to school, and I was like, I don't have the money to join A1 and all that. I'm a labor and delivery nurse, so I didn't have the money to do any of that. Well, I've been a nurse for 15 years, and I'm not rich now, but I do have a few nickels and dimes. And I thought to myself, why haven't I joined anything yet? And so thanks to researching, thanks to the research I did with this for you, I will tell you that as of today, I have joined the American Nurses Association and my state nurses association. And this is my first professional membership in 15 years. But I don't want that to happen to the rest of these nursing students, Dr. Grant. So I need you to speak to why we need to do this.
You are right there, and this is where I get to preach the gospel here.
Yes.
Because when I was an educator, and when I would speak with students, I would always tell them, there's 3 things they need to do when they graduate from nursing school, or 3 organizations they need to belong to. First one is your state nurses association. The second one is ANA, and usually you can join those together, and particularly there in South Carolina, and you have a wonderful chief executive officer with Judy Thompson, and your president is also a fantastic person as well. Actually, I just had a conversation with her about a month ago. And then the third one is your specialty organization. Between those 3, you should get enough information to know what is going on within the profession and within your specialty. But the reason that a lot of students may ask is why, especially younger students, they don't they don't tend to belong, or they belong if there's a cause, and then once that cause is over, that is it. But my rationale, or what I preach to them, is if you don't join your profession and actively, notice I used the word actively, participate, then someone else who's far removed from nursing is going to be dictating how nursing is practiced.
Wow.
Now, we call ourselves a profession. In order to be a profession, there's several criteria. One is, obviously you got to have a body of work, which we do. You got to have self-governance. And nursing has that, but we have a lot of people who try to dictate to us, what we can and can't do. Right. And historically, because, and this is not to slight females, but because of the way females were treated years ago, you were subservient. And, I'm sure your students will probably recall, or even just looking at some of the TV shows, how nurses were always subservient to the doctor. I mean, I remember when I first started nursing school, it was just at the end of the era that whenever doctors would arrive on the floor, the nurses would stand up and give them their seat, and all this is like, wait a minute.
I was there for that. I was there for that.
So if we don't, join by the numbers and have some say-so in how we are practiced, then we're going to continue to be included in the room and board. This is something that I'm having discussions about now, is we've got to be taken out of the room and board. If a physical therapist can charge for what they do, an occupational therapist can charge what they do, a respiratory therapist can charge for the work that they do, a doctor charges for the work that they do, why can't nurses, right?
Exactly.
So we need to rethink that and truly grab a hold of our profession and have a say in how our profession is governed. And we can't do that with people who just sit on the sidelines. And it's easy to be an armchair quarterback, but unless you're actually in the trenches, and this was instilled in me in nursing school, because my professors said, if you're going to consider yourself a true professional, you join your professional association. Right. And they didn't only talk the talk, but they walked the walk, because when we had to go to our regional meetings or our chapter meetings or even our state meetings, they were there. And not only were they there, they were actively participating. They were up at the microphones. They chaired committees. So they showed, us how it was done. And I was happy to, once I graduated, to assume that, those positions as well. And that's why it's so important for students today to, to join their professional association. And I tell them one of the best things you could do is, when your parents or grandparents say, what can I get you for graduation? Tell them, get me a membership in my professional. They would be so proud to know that they're doing that for you. In some cases, they may want to even just renew it for you, the next year and the next. So that's a great way to, to get started. And they usually, I know State Nurses Association and ANA, they usually have a reduced rate for students for the first year, so that you really don't have to pay that exorbitant price. And it's not really exorbitant, but if you're a new graduate and then now suddenly you may be hit with student loans, you got to get an apartment and everything else. You do have to budget your monies, but they can. Most of the times they do offer a discount rate for a new grad.
Well, we definitely will make sure our students know that, because it is really important. And like you said, we're playing on the team without a jersey pretty much if we if we, are doing that. And I tell you, here in South Carolina with nurse practitioners, I've seen some of my faculty I had before go to bat to change, because we had so much strict governance over what we could do that we couldn't really do anything. And we recently had some updates that really freed us to be able to practice a little bit more, which is really going to help the public in general. So
that's done through the South Carolina Nurses Association. Kelly Boudette, your president, she keeps us apprised of that, and we're having the same thing here in North Carolina. We had this is the third time actually our NP bill that would allow for full practice authority, has come up for to the legislature for a vote. Each time we felt, oh, it's going to be great, So this time we have dotted all of our I's, we've crossed our T's. We've gotten the consent of the medical society, that they are not in opposition. So we're just waiting on that vote to come through.
Yes.
And I'm hoping that North Carolina will be the 24th state that will allow full practice authority
Oh,
for.
that would be
Yeah,
awesome.
yeah,
I
yeah,
mean, because
yeah,
people have no idea what a struggle that
yeah.
presents. And
It is.
especially when you have folks like I was telling you, one of the male nurses that I
Mhm,
interviewed was named
mhm,
Bradley
mhm,
Bigford, and he
mhm,
has a mobile urgent care business
mhm.
in Idaho.
Yes.
And, in states like that, if you don't have
Yeah.
practice authority,
Mhm.
there's a whole section of the
Oh,
population
yes.
that's going to be missing,
Mhm. Oh,
going to be
absolutely.
missing services.
Yeah.
So it's
And
truly important.
And when you've got a state as rural as Idaho, where there's, really healthcare deserts. I mean,
Mm-hmm.
look at, I don't know if you're aware right now, but Idaho is rationing healthcare because of the, the pandemic, and the hospitals are just overwhelmed. They're now beginning to ration healthcare. And
Wow.
this is 2021. That should not be happening. But
No.
again, it's because of such restrictions like what we see
Mm-hmm.
on advanced nurse providers who can go out there and make a difference, but yet they're strung up by their hamstrings,
Yeah,
and it's
hands are
all
tied.
it's all just a money issue. That's
Mm-hmm.
our physician colleagues. Sometimes they don't want to see us as colleagues, but then they're afraid that we want to take over what they're doing, and that's not it at all. It
Mm-mm.
is the
Mm-mm.
collaboration. It should be viewed as a collaboration, and it shouldn't be that you feel that we're going to be taking money out of your pocket. If anything, we're going to try to lower healthcare costs, get to the person who may have that chronic illness that doesn't get checked on all that often, and then they wait until the last minute and they're using the emergency room as their
Mm-hmm.
primary care provider. That's how we begin to
Exactly.
drive
Well,
down healthcare costs. Yeah.
yeah, and the collaboration helps all of us because it allows
Mhm.
them, the physicians, to function at a different level,
Right.
which is
Absolutely.
great, and then we're able to fully function at our level. So it's really great. Well,
Absolutely.
I want to respect your time, and I
Mhm.
thank you so much for having this conversation with me today. And I do want to end with a final question, which
Mhm.
is looking at where we are now in healthcare and all that you know about nursing, looking back and looking forward, what are you most hopeful about today?
Great question. Nursing is on the brink right now of some really great challenges, and we can either make or break, where healthcare is going to go. And I'm hoping that as we begin to plan to do a review of how we did during the pandemic and et cetera, this is our time as nurses to change not only the nursing profession, but to change healthcare and how it is practiced in the United States. We need to be ready for the next pandemic, which I'm sure is right around the corner.
Mm-hmm.
We need to embrace innovation and technology that will be able to make our work and our lives that much easier. But we still can't forget about the patient. It's still that one-on-one, that is there. But incorporating, innovations in technology that will allow us to work smarter and still provide the high quality of care that is going to be needed. And as I mentioned, the nursing profession itself, I think, coming out from under the room and board in the acute care setting, but being able to function as essentially an independent, professional organization that we are. So I see great things ahead for us. It's just a matter of getting there, and we're starting those conversations. So somewhere within the next 3 to 5 years, I think we're going to see. We already have the respect of the public, have been for the last 20 years. So.
Mm-hmm.
And more so over the last year and a half. So I think the one group that we really need to win over has already been won over. So that's one big hurdle that we have already crossed. And it's just a matter of dealing with regulatory agencies and
Mm-hmm.
governmental agencies that has put stumbling blocks, if you will, in our way. So I see
Yeah.
nursing coming out big and strong as a result of, after the pandemic is over.
Well, that makes me hopeful because you are just the kind of man to turn a stumbling block into a stepping stone, Dr.
Oh,
Grant.
thank you.
So we appreciate your time. Thank you so much. And at some point in the future, I'm sure we'll get a chance to talk again. I'm working
I'd love
to
to.
kind of get a nursing podcast thing going with some storytelling that
Absolutely.
will hopefully help some of the nurses that are going through what we have going on now. But for now, I hope you have a great day and enjoy this Carolina fall that's coming. I'm a summer person, but I'm going to embrace fall with the pumpkin
I'm a
people
fall
for right
person.
now. You are, well, it's your time. Get you some
Yes,
pumpkin
it's my
spice and
time.
enjoy
Okay.
it.
All right. Thank
Take
you.
care.
All
Bye-bye.
right. Bye-bye.